Yes, it's true. 7-Day Dental has the best doctors and great staff. It's also true that we use the latest technology. But did you know that the owners of 7-Day Dental are also the founders of AdoptASoldier.com?
I am Dr. Christine Chung. If you make 7-Day Dental your dentist, I would donate a portion of your bill to help our soldiers. Together, we will make a difference.
Call us, make your appointment today.
Well, from 7-Day Dental today, we have Dr. Christine Chung and Dr. Chuck Lee. Nice to have you here today.
Thank you and good morning.
Good morning to you. And you wanted to talk about bad breath today, and but what causes it, what you can do about it, all that, right? So, who wants to begin on that one?
Okay, yes. So we will start today with bad breath, which everyone's concerned, and common causes: poor oral hygiene, bad dental health habits, that you don't brush, you don't floss daily. When you eat, bacteria start to form, release toxin, and that's why it gives bad breath.
And we aren't talking about, when you talk about bad breath, we aren't talking about, okay, I just had something with a lot of spices in it or garlic in it, you know, kind of the temporary bad breath we're all going to have depending what we eat.
Yeah.
You're talking about something that may be chronic.
Yes,
Yeah.
yes,
Okay.
yes.
And a lot of times, defective fillings or crowns that are open, or
Right.
crowns that are cracked, or partials that are not fitting well anymore, that are rocking around, they
Makes
get more
sense,
food
yeah.
trap.
Sure.
And a lot of times it's dry mouth. So as one of the side effects of medication is dry
Yeah,
mouth. So
exactly.
a lot of, as we age, we start taking more medicine for high blood pressure, cholesterol, all types.
Yeah.
You know.
And even some of the over-the-counter ones you
Yes.
take, like nasal medications
Yes.
or something like
And
that.
one of the,
yeah.
I mean, it affects everyone differently, but side effects could be dry mouth, and that definitely will cause you to have bad breath.
Well, if there is some sort of, you know, people have to take their medications, what can be done for that symptom, for dry mouth, besides just drinking water, which of course isn't really the solution, is it?
Well, we have to see why we were with dry mouth in the mouth, because saliva acts as a cleaning agent.
Yeah.
So when you have dry mouth, what we want to do is we want to recommend you to have fluoride to supplement and to kind of strengthen the enamel. And also, some cases of severe dry mouth, we would recommend to have a fluoride tray, because that way we can get the fluoride to go all around your teeth, 5 to 10 minutes a day, and that protects your teeth. It's kind of like compared to a person that's maybe sensitive to the sun. So instead of maybe putting one layer of sunscreen, you might want to put 3 or 4 layers. You know,
What's the
just-
fluoride tray? Explain that.
Fluoride tray is like a bleaching tray that
Okay.
that customized and fit over your teeth. The problem when we just brush on fluoride, you only get the front surface and the back surface, but you're not really getting in between,
Sure.
and you're not getting the certain areas, the cracks and all that. So by having a tray and putting the fluoride in, it will coat the whole teeth.
Okay,
All the teeth.
it's like a gel or something?
Yeah.
Okay.
Yeah, you just put it.
And that works better than, you've seen the fluoride rinses.
I think so, because you're going to leave it a little
design.
longer.
Sure.
Yeah, and the fluoride rinse is, believe me, that is fine for most people. But there
Yeah.
are cases where
Sure.
we will recommend high cavity rates. We would recommend that.
Okay. And what about if it's something that it could be beyond that? And as you mentioned, it could be a loose filling or dentures or something like that, and that can be remedied as well, right?
Yeah, because when you have a loose filling or broken filling, bacteria can get under in that
Yeah.
hole, get trapped. As you know, bacterial formation release toxins, so it delivers bad breath. So the first thing you would do, I would recommend to have check out at the dental office. Let your dentist decide if it's a periodontal or any gum tooth-related issues before we can determine whether it's a medical issue.
Right, like in the esophagus or
Yes,
lower.
yes,
Yeah,
yes.
exactly.
So
Yeah.
research shows that 90% of halitosis, which is bad breath,
Yeah.
is coming from the mouth. I
Okay.
mean, from the teeth or the gum
So
or
that
the
way,
tongue.
that's a lot easier to remedy
Yeah.
than something that is more medical. That's
Yes.
down lower
Yes,
than that.
yes.
Yeah.
Yes.
But there are cases that, then we try to resolve all the dental
Okay.
issues and then refer to the MD.
Okay. Yeah, that makes a lot of sense because you want to look at the things that are the easiest to combat
Yes.
first.
Yes.
Yeah.
And it could be a very, very simple solution.
Yeah.
Just one thing needs to be changed.
Yes.
And that's great. And it's one of those things where maybe the person doesn't know it, but other people around them
Yes.
do, right?
Yes, it's-
They see people backing off, then they know.
And I want to reinforce that it's very true when you have periodontal or gum disease,
Yeah.
you're not aware of that, but the person in front of you, when you talk and speak,
Mm-hmm.
they can see that you have bad breath. So I do encourage you to go to the dentist regularly.
Yeah, because you guys can pick that up right away.
Right,
Yeah.
and we have evidence. We measure the pockets. We let you see on the X-rays.
Yeah.
And some patients, they do come in every 3 months, 4 months, 3-4 times out of the year to
Mm-hmm. Very
maintain
good.
that condition.
Yeah. Just along those lines, and I know this is not a cure, but I'm going to bring this up about chewing gum. And, you always see that the sugarless gum and the old ad for Trident, that it helps at least after eating to chew something like that. Is that true?
Yes.
It's very true.
It is
Yes.
true.
Yes.
Okay.
Chewing gum will stimulate more saliva.
Okay.
Yeah.
Yeah, so.
And of course,
so-
you guys want the sugarless gum.
Yeah.
Right.
Especially for dry mouth, it's
Okay.
recommended to do that.
Very good.
For a cancer patient who's going through chemo or radiation
Mm-hmm.
therapy, they definitely have dry mouth. So we recommend chewing more gum. Drink
That's
a lot
good
of
to know.
water and use oral rinse,
Okay.
antiseptic oral rinse. Yeah.
Very good. That's good to know. I always kind of wondered. You remember those ads that they used to
Yes,
have? I
yes,
think they
yes.
probably still, and you kind of wonder, was that just marketing, or it's nice to know that it does help. Let's talk about some great discounts that you offer. I know you have a great veterans program. Am I right?
Yes, yes. So we do give 20% across the board for our new patients,
Mm-hmm.
and for veteran, on top of that, we give even further discount of a 5% additional.
Oh, great.
Yeah. So 25% for veterans.
Okay.
And 20% for the rest of the community.
That's great.
Yeah.
That's a substantial discount. And as you said, Christine, how important it is just to come in and get a checkup. Maybe everything's perfectly fine,
Yeah.
but you could spot something that's not, or it can be something very minor, or it could be major, right?
Yeah.
Exactly. And I want to reiterate, Dr. Lee was talking about even dentures, partial full dentures. You still need to see your dentist because
Yeah, sure.
ill-fitting dentures don't fit right. So
Yeah.
you accumulate a lot of bacteria built up underneath the denture
Yeah.
that adhere to the gum tissue, and that can cause bad breath as well.
Yeah, definitely.
It is recommended that dentures and partials, well, dentures for sure, get relined at least once a year.
Okay.
Yeah, so a lot of patients, because they don't go for reline because they don't feel like it's loose, because it's loosening slowly, but they don't realize. It's kind
Yeah.
of like losing weight. If you lose 10 pounds for over a year, you don't see it so much, but if
Right.
you lose 10 pounds in one day,
Yeah.
you can see a big difference. So,
Okay. Well, that makes a lot of sense for sure. And it's good advice about the bad breath, and you may not know that you have it. So go in and see Dr. Chung or Dr. Lee or any of your other staff there, and they'll find out about that right away. Thank you very much. 7daydental.com, and you're open nearby here. What are your hours over there? Over here by
Bonds, yes, we're open from Monday to Friday, 9 o'clock to 7 o'clock, Saturday, 9 o'clock to 3 o'clock, and Sunday by appointment.
All right. Doctors, thank you very much.
Thank
Always good
you.
to see you.
Thank you for having
And
us.
we'll be right back.
Yes, it's true. 7 Day Dental has the best doctors and great staff. It's also true that we use the latest technology. But did you know that the owners of 7 Day Dental are also the founders of AdoptASoldier.com?
I am Dr. Christine Chung. If you make 7 Day Dental your dentist, I would donate a portion of your bill to help our soldiers. Together, we will make a difference.
Call us, make your appointment today.